Hi, my name's Lori McGinnis, and I'm a below-the-knee amputee from a motorcycle accident 5 years ago. And I recently underwent osseointegration in Sydney, Australia with Dr. Munjed Muderis. So I just wanted to make a little video and give an update on my progression with my healing and just some info for people to know what osseointegration is more about. So basically with osseointegration for amputees, they implant a titanium rod in the bone of your residual limb, and then it protrudes out the end of your limb, and you attach your prosthesis to the implant rather than attaching it with a socket, which is a majorly huge improvement, right? Typically it's either femur or tibia, and there's been a lot more femurs done than tibias, so above knee amputees have been done much more often. But Munjed Muderis is one of the doctors that's doing below the knee. I think he's the only doctor that's doing below the knee implants right into the tibia. Because my knee was damaged, I also had a knee replacement with mine, so it's a quite extensive implant. There's only about 5 or 6 people in the world that have it. So this is basically life size. There's a rod that goes up my femur, then a knee replacement, and then the rod goes out my tibia, and then I attach my prosthesis to the implant. So it's settled in and healed up great. I've had no issues with the implant itself healing and the abutment out the skin. Like your body just heals up like any other kind of joint replacement or, rod implant in your body just heals up, right? So that's been great. It healed up like that. Doesn't hurt. I mean, people ask me where it protrudes from the skin, does it hurt? It doesn't. But see, there's a metal rod coming out of my leg, yo. It's pretty crazy. And it freaks some people out, but not me. But typically, this is how the amputees in the world attach their prostheses, right? You typically have a custom liner. Well, custom is a high-tech. This is high-tech. Custom liner that is made of silicone, does not breathe. You would typically roll that on your limb. It's very hot. And then you use a few socks, depending on if your shape has changed during the day or if you need to fill space. Could use a mini socks. And then you step into your socket, which typically sits on the top of your leg like this, right? So then you would step into the socket, and then another sleeve goes over everything onto your leg, and you press a button on a pump that sucks all the air out, and then it's suctioned onto your little leg. And for me, it was my damaged little leg, but that was a lot of friction to tolerate and a lot of forces, so I did not tolerate it well. And now all of this is replaced with this. It's so great. I need to slide it on. Like that, right into my leg. And my weight now is on my skeleton. It's not through the soft tissue. My nerve pain and my phantom pain is calmed right down because I don't have the constant forces on my, irritating the nerves. I don't have any of the issues with having to take my leg off every couple hours because I had 2 in a socket. I couldn't tolerate wearing it for more than 2 hours. No matter what I was doing, I was always taking it off. My life just revolved around it. Like everything I did, I had to consider, will I be able to wear my socket, or if I wanted to go in the water, I'd have to have a different leg, and everything was just different. Everything revolved around it. And now it's so streamlined. All I have to worry about is the pylon down and the foot. So it's just so much more simple. And the issues that I'm having are with my patella tendon. So my progress has been great, but I've had a couple setbacks with my patella tendon because my knee was scarred up for so long that the tendon integrity is really poor. So within 2 months of having my implant, my patella tendon tore, and I had to have that reattached, which was a hard recovery. And now my quad tendon is actually torn, and I have to have that replaced or reattached in the next few weeks, I think. So that'll be not a fun recovery either in the middle of summer. But those are things that are fixable, and they could happen to anybody that has a knee replacement. Typically, osseointegration doesn't include knee replacement. Usually it's just a rod inserted into your remaining bone, but mine was more extensive than that, so that's why I'm having these extra issues. The implant itself is doing great, it's just my tendons are not cooperating. So even with a quad tendon torn, I can walk pretty well, so I'll show you that. And I don't have the typical binding up behind the knee of all the liners and the sleeve And the socket that, you know, cuts into your knee range, you know, that's all gone. So that's been a major improvement too. And the summer, the heat is, you know, manageable. I don't have any kind of heat issues like everyone else has around the socket. So that's been my experience with osseointegration so far. I still have some healing to do with my tendons, but the osseointegration has been amazing, and I would recommend it to anybody that's a candidate and can get it. It's exciting that there was recently one of the implants was improved in certain situations, FDA approved in the US recently, so that's a step forward to make it more accessible to anyone that's a candidate and wants to get it, right? And I'm the first Canadian to have it done. Woot woot! So that's about it for now. Okay, spread the word. Osseointegration rocks.